Hello viewer, ujambo. Welcome back to this YouTube channel where I, Grace the Nurse, talks about mother and child health care. We are on our running series of family planning. We talked about the introduction of joining a family planning program, and we said today we are going to see how a pregnancy comes about. Because for family planning, the aim is to delay a pregnancy. But do you know how a pregnancy comes about? Join me as we go into details of this running session of today. So to answer the question on how a pregnancy comes about, we have to have it in mind that a pregnancy comes about when two things happen. Rather, there are two people must participate for one to have a pregnancy. Two people. And who are these people? There has to be a man and a woman. And for a pregnancy to take place, there has to be a conducive environment. So when the environment is not conducive, a pregnancy cannot occur. But if the environment is conducive, a pregnancy will definitely take place. This is because they say to a woman is ovulation and to a man is ejaculation. To a woman is ovulation and to a man is ejaculation. So when a woman ovulates, she produces an ovum. And when a man ejaculates, he produces a sperm. Rather, sperms. For a woman, it's only one when she ovulates, but for a man, when he ejaculates, it can be more than one. So for a pregnancy to occur, there has to be a man and a woman. A woman has to be going through the process of ovulation, and a man has to be going through the process of ejaculation. So when the end products of ovulation and the end product of ejaculation meet at a conducive environment, then a pregnancy takes place. Is that clear? So for a pregnancy to take place, we have explained how a pregnancy comes about. So when the ovum and the sperm meets under conducive favorable conditions, they produce a pregnancy. And that is where now, when we were introducing this topic, we said when a woman uses a family planning method, she lowers her fertility. That is why we are saying when the sperm and the ovum meet at a favorable condition. So in this case, if you are using a family planning method, you are reducing the fertility, meaning the pregnancy will not do what? Take place. Okay? So for one to control the pregnancy, a birth control method has to be used. And this is what we are calling family planning method. To avoid a pregnancy, a birth control method has to be used. And this is where the word family planning is coming in. So the question is, how does one choose a birth control method? How does one choose a birth control method? This one depends with the reason why. Why are you using a family planning method? The family planning program has three categories of using a family planning method. The first category is one using a family planning method because she has just had a baby. That is category 1. Category 2 is it a youth or an adolescent using a family planning method? And then number 3, is it because you are grouped as people of special needs? Yes? 3 categories of people are grouped when it comes to choosing a family planning method. And these groups are, group 1 are the ones who are using the family planning method because they have just had a baby. Group 2, is a family planning method. Is it you are using as a youth or an adolescent? And then number 3, are you in the category of people of special needs? I know it's a bit contradicting when I mention the category of youth and adolescent, but I'll come to it in details later. For the family planning method, the grouping is also done, whereby when you want to delay a pregnancy, you can either use a device, you can use a method, you can use a procedure, or changing behavior. Yes? When one is choosing a family planning method, you can either use a device, a method, a procedure, or changing of behavior. So in this case, what are we saying? We are saying that for you to acquire a family planning method, you need to visit a reproductive health service facility and get a service provider for healthy timing and spacing of pregnancies service, that is HTSP. You visit a health facility of your choice and get a service provider for healthy timings and spacing of pregnancies service. This is where you will be cancelled on family planning methods, either by you use a device, you use a method, you use a procedure, or a device. You'll be advised about changing the behavior. I don't want to mention them one by one because this one is a public domain. I want, when you decide that you want to delay a pregnancy, visit a health facility of your choice and you will be attended by a service provider who is labeled healthy timing and spacing of pregnancy service provider or a family planning clinic. Thank you. Hope you got some info and this info is helping you on your day-to-day life. Thank you. Thumb up, subscribe, and share with friends. Cheers.